If you ever heard about the grumpy old men, it's because they don't have testosterone.
Hi, I'm Stephanie Wolff, PA and CEO of the Novus Center, and today I am bringing Duane Reed, one of my patients here, to chat with you a little bit about his experience at the Novus Center. Thank you so much, Duane, for being here.
Thank you, Stephanie.
How did you find the Novus Center? What were you looking for? How were you searching for it?
I looked a bunch of places, and the Novus Center seemed like it would be the nicest, so I was a little bit leery. But after talking to some of the medical places, Novus Center was the right place.
When you did choose to call the Novus Center, do you mind explaining, your first phone call? Who did you talk to? What was that like?
I wasn't knowing what to expect, but Kale was there, someone to greet you. Everything was just as comfortable as could be, straightforward, told me exactly what's going to happen. Everything that they said was going to happen did happen.
And what was the very first call, or what were you looking to treat when you came to Novus?
I basically was more interested in my shoulders, but I also had been looking about erection dysfunction, but the shoulders were the main point. No one else really had both. And I go, well, if this works for the shoulders, it's got to work maybe down there too.
As far as your shoulders go, you said that you were having shoulder pain. How long were you having shoulder pain?
7 to 8 years. Unbearable. I had a hard time washing my hair, almost not being able to reach my back. The shoulders were just inflamed.
Okay. Did they send you to physical therapy? Did you have steroid injections?
They tried physical therapy, but any kind of physical therapy just aggravated the situation even more. Okay. So doing nothing would be just keep it isolated was much better.
And did you end up going to see an orthopedic surgeon, and what was his recommendation?
Both shoulder replacements. On contact. There's very little cartilage left. It's going to get worse, and there's nothing we can do.
Wow. So how did that make you feel?
With my age of being 65, I sort of expected a little bit because I did heavy construction. I always thought there was hope. I heard from one of the people that I play cards with that there was some kind of where they do some plasma-enriched cells. Didn't know too much about it, so I researched a little bit, and sure enough, the Novus Center is exactly what I was looking for.
Now, you came in and you decided to get both treatments, both for your shoulder and for the erectile dysfunction. Can we talk a little bit about the erectile dysfunction?
Sure.
How long were you experiencing that?
I was not experiencing total dysfunction, but you could tell that I needed improvement. Yeah. And improvement came very rapid.
When you had your consultation with me, that consultation is an hour and a half, which a lot of people who call into the office, they go, oh, I don't need an hour and a half. Like, why can't I just have a half hour sitting with Stephanie? Why do they need that hour and a half with me?
The hour and a half is because of the medications that are going to find out what exactly is right for you. Each person's different. You have to, and I was one of those people a little bit where I go, oh, I don't need all the blood tests or this and that. But for Stephanie to work, after you hear what she has to say, you need it, and then she has somewhere to go from. You're not blind. Yes. Improvement can only happen.
It's completely detailed, yes. And it's customized to you.
Almost too much.
Yeah, it's not a one size fits all.
No, it's not.
Everybody's different.
Right. My treatment for what I needed, and it's been perfect. It's
been working.
Sometimes you wonder if a woman could really understand what a man goes through. You're definitely there. You're definitely there. And taking that it is a problem for men.
So when you first started, right, you go into the room and Jada was your nurse?
Yes.
When she first started treating your shoulders, did you experience pain with the Shockwave? Like, no. What was it? What did it feel like?
It was a little bit of zapping, a little bit. You'd see some movement. But what they explained to me was there was for blood circulation. And for sure, afterwards, immediately, you could tell there's something happening.
You weren't in pain afterwards? No. And that night when you went home?
None whatsoever. And each time it became better and better until we had the plasma-enriched cells. And that's when everything just happened and everything got a lot better.
And how many treatments did you end up having on
Just one.
You just had one treatment on your shoulders?
That's it.
That's incredible. After 7 years?
Yes.
So then we do platelet-rich plasma, which is the injection into your shoulders. And we did both shoulders.
Yes.
What was the pain like that?
Very little. The injection didn't hurt. If you've ever had a cortisone shot, it was about maybe less than that, but totally just normal. Jada explained to me that it might hurt a little bit, so don't worry, but everything will be fine in a couple days. Sure enough, a couple days, almost full movement
Wow, that's incredible.
and no pain.
And no pain. And you didn't have to take any pain medication.
None whatsoever. I've never taken pain medicine. I've just sort of muscled through it or take anti-inflammatories instead.
And how long has it been since your last treatment on your shoulder with the PRP?
It's been almost 100 days.
100 days. And where are you at today?
Absolutely perfect. I can't believe it.
So we're just hoping this continues,
Right.
right? Continues to improve.
And I want to go maybe one more treatment with plasma-enriched cells so that we get the full benefits. And if it's anything like the first one, I'm just looking forward to it.
Great. Now, as far as the erectile dysfunction goes, when you had your very first treatment, did you apply numbing cream?
Yes. Kale mentioned to me there was a little discomfort for 2 or 3 minutes, but besides that, no big deal whatsoever. Very easy to apply, very unnoticeable. And with the Nova Wave, very little, almost nothing, no pain whatsoever.
Okay, so the treatment was fairly simple for you.
Oh yeah, very simple, like
And
nothing.
how long was the treatment?
About 30 minutes.
Okay, so 30 minutes you're there, you're undressed, but you're numb, and you've got Jada who's very pleasant and kind, and the treatment is not uncomfortable.
No.
Okay, and how many treatments did you end up doing?
Oh, I did 4 treatments 1 week apart. And then I did the plasma-enriched cells. And then I went on vacation for a little bit. And I was ready for vacation.
What did you notice as far as the dysfunction, let's say the first week after your first treatment?
You felt that your penis was a little bit larger. It felt heavier. You started waking up with an erection, which has been off a long time. And at 65 years old, you got to like it.
Yeah. Now, did you have to do the pumping as well?
Yes. The pumping followed. Just a minor pumping adds to the blood flow. You notice a big difference at the very beginning. Definitely part of the treatment, and goes along with the Nova Wave.
Was it difficult to use the pump?
A little confusing. I think each person's a little different. Kale told me a little bit about what to expect, but I think every individual needs to sort of work with it. It's not difficult.
Yeah.
It didn't really think it's sort of self-explanatory.
I usually tell patients, the first week of using the penis pump is just, it's kind of like this. You don't know. You don't know what's going on. You're trying to learn how to do it, figure out yourself.
Yeah.
But then the second week comes and you're like a pro.
Yeah, you're like a pro. Then my actual girlfriend sort of likes playing along and actually participating. Up, down, up, down.
So after your 4th treatment with the Shockwave, you then had the PRP injection into the penis as well?
As well.
And was there any pain or discomfort with that?
No pain, much discomfort. I would imagine over the period of like maybe 3 months, there has been more improvement, but not as much as the shoulders. The shoulders were just out of this world.
Okay, great. And then you came to see us for hormones.
Yes.
And why did you come to see us for hormones?
Well, I've had a low testosterone most of my life, and I've had shots before, but they discontinued the shots because they just said it's not. So they gave me a little bit of testosterone cream. It's okay, but it wasn't doing what I wanted to do. Not like it did when I had the shots.
Now, with the cream, what was it that you were wanting the testosterone to do? What were you looking for?
Because I've been low on testosterone, the cream was supposed to take care of the shots, but never did. And I even tried every once in a while if I knew sexual activity was coming a little bit, maybe twice a day at the beginning. But from the actual testosterone injections are just so much superior. If you ever heard about the grumpy old men, it's because they don't have testosterone.
I agree with you.
Okay, so no, you're just the first time I had my first injection maybe 7 years ago. As soon as it went in, you just realized that you were testosterone low, and obviously it's just the best feeling ever. You just feel young again, happy again, and your confidence is way up.
Good. And what about performance? Your sex drive? Does it help with sex drive?
Nova Wave brought everything back to where you just get erections strong, more than 50% better, and just you just knew it was working.
And then now you have a sex drive because you're on testosterone. You have more energy.
Sex more often.
What is happening? Who are you?
Duane from the Novus Center.
Now, what would you say? What's the next thing in store for you? What are you looking to accomplish now that you've accomplished all these other things?
Just keep it maintained about the level that I am now, more than I can ask for.
You know, I look at so many of these men just walking down the street or at the grocery store, right? And you just kind of look at them like, I wish you knew that there was something out there for you. Like, I know that you're suffering inside.
It was notified. I don't know what they were actually talking about, 7 or 8 years ago, but I didn't keep in contact, but they said it was very expensive. And so far, this has been very reasonable.
Yeah. I mean, when you think about long term, just like you said, what is that cost, right? To have your life.
Yeah, no, it's about the good life. My doctor used to tell me all the time, good life. If that's what you want, go for it. You never know when your last day is going to be. And being sexually active at 65, as happy as can be.
Are you currently dating?
Yes,
Yeah. And how's that going?
it's going great. I would imagine I'm not one of the marrying type, but she's very happy with that, and she's definitely happy with my performance.
Good, good. You know what they say.
When the sex is good, nothing else matters.
If mama ain't happy, ain't nobody happy.